Usapang kalusugan sa Health Check Plus. Alamin ang mga payong medikal galing sa mga totoong eksperto. Ang kaalaman ay kapangyarihan. Usapang kalusugan sa Health Check Plus.
Check na araw mga health checkers sa Luzon, Visayas at Mindanao at sa mga nakikinig at nanonood sa iba't ibang panig ng mundo sa DZRH Radio, digital TV at social media platforms. Ako po si Teacher Ellie Campos Banayat. Samahan niyo po kami dito sa programang pinagkakatiwalaan ng mga eksperto, ang Health Check Plus. Buwan ng mga kababaihan ng Marso, mga health checkers, kaya't mga issue at concerns ng mga kababaihan, kalusugan ng kababaihan, ang ating bibigyan pansin sa buwang ito. Noong nakaraang linggo, kausap po natin ang isang haligi ng pelikulang Pilipino at maaaring higit pa roon, si Miss Beth Orteza ay isang cancer survivor. Napag-usapan natin kung ano-anong treatment ang kanyang dinaanan at papaano nalaman na may breast cancer pala siya. Kaya naman naisip natin na imbitahan ang isang eksperto sa cancer imaging. Chairman ng Nuclear Medicine and PET CT Center at Healthway Cancer Care Hospital, atin pong i-welcome si Dr. Raymond Augustus o Conlu na kamakailan lamang ay nagbukas at Chief Executive Officer din ng Dr. Conlu PET CT Center sa Mandaluyong. Welcome back po sa Health Check Plus, Doc Munich.
Thank you, Teacher Effie. Magandang araw sa mga health checkers.
Doc Munich, alam niyo po, napaka-interesting ng inyong specialization, pero maaari niyo po bang ipaliwanag sa ating mga health checkers, no? Sa ating mga nakikinig at nanonood, ano po ba ang ginagawa ng inyong specialization at ano po ang role o responsibilidad ninyo sa larangan ng cancer care and management?
Okay. So, there can be two groups of doctors. Yung isa po ay yung mga naggagamot, and then yung on the therapeutic side. Ako naman, I'm on the diagnostic side of medicine. I'm a radiologist and nuclear medicine specialist, but I focused my practice on cancer imaging. It's more of nuclear medicine, doing PET CT for the past 20 years. So yun ang aking expertise, cancer imaging.
I'm sure po maraming sa ating mga health checkers na nakikinig at nanonood ngayon ay familiar, no, sa ating diagnostic. So, gaano po ka-importante ang inyong role sa cancer care po? Ano po ba yung nagiging importansya nito or benefit para sa ating mga pasyente?
Well, kami, since we're on the diagnostic side, tumutulong po kami sa mga referring doctors to guide them to what treatment they will give to their patients. So, if you're familiar with CT scan, no? Mas marami kasi familiar sa CT scan. Ang CT scan po kasi, we look at the anatomy, the inside of the body, no? Nakikita natin doon yung mga tumors, yung mga bukol, yung mga lymph nodes, etc. But with the PET scan, ang PET scan, titingnan niya yung activity ng mga cells ng mga tumors. So magkaiba po sila. They complement each other, but they are not competing. Kaya sa tinawag na PET CT, you get the best of both worlds. Yung CT scan, na titingnan natin yung sa loob ng katawan, and then yung PET scan. So, in other words, with CT scan, you're looking at disease on an anatomic level, based on anatomy. But with the PET scan, we're looking at disease on a molecular level. Kung ano yung ginagawa ng mga cells sa ating body. Yun ang nakikita ng PET scan.
Yun po pala yung pagkakaiba, Doc Munich, ng CT scan. Tulad ng nabanggit ninyo, mas familiar nga po sa aming mga health checkers yung CT scan, kumpara sa ating PET scan. Doc Munich, meron po bang iba't ibang uri din ng PET scan at ano-ano po ito?
Yung PET CT scan is just one machine. Actually, two machines in one country, no? One PET and CT. Pare-pareho lang po yan. Ang pinagkaiba lang po is yung the type of radioactive tracer na ini-inject po sa pasyente. But the most and widely used radioactive tracer is still the FDG, no? Yung tinatawag nating radioactive sugar. But bakit natin ini-inject po ito? It's because studies have shown cancer cells will eat up more sugar than normal cells. So pag meron po kayong cancer cells in your body, umiilaw po siya sa PET scan. No? Kasi yung mga cancer cells will eat up that radioactive tracer more than the normal cells. So iilaw siya. Kaya yung mga pasyente alam nila yan. Dok, umiilaw pa yung cancer ko. No? So, yun. That's FDG PET CT. For most solid tumors, we still use FDG, no? PET CT. Yung mga iba namang types of radioactive tracer, like for example, PSMA, PET CT, is specific for prostate. No? So, may mga ibang cancers na pinagagamitan ng radioactive tracer, like example yung prostate, yung neuroendocrine tumors, specific po sa kanila. But for most tumors, we still use the FDG PET CT. Yun pa rin.
Yun po pala yun. Alam nyo, Doc, unique kami po ay naa-amaze, no, sa inyong ginagawa kasi for sure po ay matagal-tagal ang inyong naging training, no, para maging eksperto dito sa kind ng imaging na ito. Doc, unique kami po ay naka-curious, no? Ano po ba ang impact sa quality care ng ating mga patients? At nabanggit po ninyo kanina na kayo po ang nag-guide, no, sa ating mga ibang cancer doctors for the treatment options ng ating mga pasyente. Pwede niyo po ba kaming bigyan ng idea? Ano po yung naging impact sa quality care, no? Patungkol naman or tulong ng ating PET CT scan results?
Most of our patients, karamihan sa kanila, come to us already diagnosed with cancer. So, ang forte kasi ng PET CT is in staging. No? Staging meaning kailangan nating malaman kung nag-spread ba yung cancer or localized lang. No? For example, no? Yung cancer kasi nag-spread yan either through lymph nodes, through lymphatics, through the bloodstream. So, importante malaman natin kasi naiiba yung treatment for each stage. No? For example, yung mga lymph nodes, sa CT scan, bago natin sabihin na ay abnormal yan, kailangan lalakin muna siya, mag-enlarge. No? But oftentimes, we see maliliit na lymph nodes umiilaw na. So, we catch it early. So, because the PET scan doesn't rely on size, we rely on the activity ng lymph node. So, minsan, after gawin yung PET, naiiba yung stage. Sa CT scan, minsan, early stage. Pagkagawa ng PET, minsan na upstage. We call it upstaging, no? Naiiba. Kung baga, pwedeng stage 2 siya based on CT scan. Pag ginawa niyo yung PET, nagiging stage 3. No? So, naiiba yung clinical management of the case. No? So, yun yung significant impact on the patient's management. And sometimes, na-diagnose na, no, na nagka-PET scan na siya, and then magki-treat na, magki-chemotherapy na. Kadalasan, yung mga bukol, yung mga tumors, hindi nawawala sa CT scan. No? Lumiliit siya ng konti, pero nandun. So, sa CT scan, iniisip natin baka hindi ito effective yung treatment ko. No? So, we do the PET scan. Sa PET scan, nalalaman doon, kasi pag umilaw siya, buhay pa yung tumor. Pag hindi siya umilaw, ibig sabihin, it's that my treatment has been working. So, oftentimes, we see that yung tumor sa CT scan, hindi siya nawawala. Pero sa PET scan, hindi na siya umiilaw. So, that's a big difference, no? Pag hindi na siya umiilaw, ibig sabihin, dead na yung tumor. So, naiiba rin yung management. So, that's how PET is able to impact on the clinical management. So, that way, we are able to guide the physicians what the next step would be, the treatment choices. Kasi sometimes, sa CT scan pa lang, pwede natin sabing operable to, no? To go ahead with surgery. Nung nagawa yung PET scan, hindi pala operable. So that's big difference.
Niyo po, Doc, unique talagang napasimple niyo po ang explanation ng PET CT scan, no? And I'm sure marami pong makaka-relate sa akin na sila ay naintindihan ngayon kung paano ito nag-work, no? Masasabi niyo po bang mas accurate ang ating PET CT scan kumpara dun sa regular po na alam naming CT scan na ginagawa?
The term siguro is more of pwede ibig sabihin yun. PET CT has higher accuracy than CT alone or PET alone. Yan. So, pag pinagsama mo yung PET CT, tumataas yung accuracy. Yan. But ang PET and CT, they are not competing, no? Nagano sila. They complement each other. But kung pinagsama mo sila, mas mataas yung accuracy, no? Na nakaka-detect sila ng mas yung mga even the small volume disease madedetect yun.
Yun po pala yun, Doc Munich. Salamat po sa napaka-direktang mga sagot at napasimple po talaga ang inyong explanation tungkol sa PET CT scan. Doc Munich, kami po ay curious din, no? Ano po ba ang kailangang paghahanda ng isang pasyenteng mag-undergo nitong PET CT scan? At gaano po katagal? Yan po, no? Usually, yun po yung mga tanong ng ating mga health checkers. At gaano katagal yung procedure at gaano po katagal yung kailangang hintayin para lumabas yung resulta nitong PET CT scan result na ito?
Okay. First of all, kasi especially pag yung ginagamit natin na radioactive tracers, yung FEG, we check the blood sugar. So, we make sure yung mga diabetic patients, both with diabetes, we make sure that their blood sugar is within acceptable range. Then yung serum creatinine, because if the procedure will be a contrast-enhanced CT scan, no? We need the creatinine within 1 week of the procedure, and fasting. And so far, those are the important preparations. I would not go into details na yung mga iba kasi medyo maano, but other than to tell them that we prepare our patients meticulously, no, and conscientiously. So maganda yung quality ng scan na lalabas. Otherwise, the scan will suffer. So, once injected na yung radioactive tracer, the patient will be in a relaxed environment, no? Sometimes nakahiga, sometimes nasa lazy boy, no? In a cozy lounge for 1 hour yun, for 60 minutes. That's we call that the uptake time, no? Patients can relax, avoid the unnecessary movements or stress. Then, after 60 minutes, isa-scan na po siya. And the scanning will take about, depending on the type of machine that you have. So, it can range between 20 to 40 minutes yung scan. And then after that, we do the CT scan. So, total duration, mga 2 hours. Yung nag-stay yung patients doon sa sa PET CT center. And then the results, usually most centers, we release the result within 24 to 48 hours. Pwede rin namang i-rush. There's no problem. Yeah.
Yun po pala yun, no? So, I'm sure familiar po yung mga ating health checkers dun sa mga preparation, no? So, medyo sa mga mag-undergo ng PET CT scan, kami po ay hindi na masyadong kakabahan, no? Kasi tulad nga po nabanggit ninyo, talagang i-guide ng ating mga doctors, no? Para mas accurate ang ating scan. Doc Munich, kami rin po ay curious, no? Kasi itong PET CT scan, tulad yung nabanggit ninyo, hindi masyadong familiar sa amin. Sa inyong experience po, ano po yung usual na takot or pangamba po ng mga pasyente na nag-undergo po ng diagnostic procedure na PET CT scan?
Well, ang tinatanong lang nila is yung side effect. For the PET scan, the radioactive tracer, virtually no one gets allergic to that. No, so very safe. Even those with kidney problems, no, ang radioactive tracer is safe. Ang sa CT scan lang, that's why we do the creatinine to make sure that your kidneys are functioning normally. Kasi may yun ang ng sa contrast, no? Sometimes it can affect the kidney function. So, we want to make sure your creatinine is normal. So, other than that, wala namang there's no pain. No, walang pain. It's a good experience after because, you get to relax. No, if I'm there, we get to talk about your illness. We make sure you're comfortable there sa CT center. So far wala namang yung pasyente. The only thing is yung results, because as much as possible we release the results early because we don't want patients to be anxious. I feel them na yung after leaving this, masaya sila, no, pag pasok, pero paglabas nun, there's the anxiety of waiting for the result. Ano ba? Maganda ba yung result ako? That's why, to help them, we release the result really as much as possible within 24 hours or early. So we don't want them to be anxious. And so that if ever worst case scenario, treatment can be started right away.
Yun po pala yung usual, no? Talagang yung experience ay hindi naman katakot-takot. Pero totoo po yan, Doc Munich, no? Talagang kanilang pangamba ay nandun pa rin sa resulta ng ating test, no? Doc Munich, may nagtatanong po na isang ating health checker dito. Mayroon daw po bang PhilHealth or other health insurance coverage for PET CT scan procedure?
For HMOs, it depends on your HMO. There are HMOs that cover, kino-cover naman po nila. Ang PhilHealth, I think wala pa siya sa radar ng PhilHealth, but I'm sure very soon it will be covered. Hoping.
Opo. Doc Munich, may isa pa pong tanong dito. Lahat daw po ba ng ating mga cancer patients ay kailangan ng PET CT scan?
Hindi lahat. Hindi lahat, no? Hindi lahat ng patients would need PET CT. So, but your oncologists would know when to refer you to PET CT scan. So, hindi lahat. Depende yan. Depende sa type of cancer or depende sa stage na or so it depends. It depends on your doctor. Hindi lahat naman ng cancer kailangan ng PET.
Specific for potential cancers po among women, Doc Munich, ano po yung usual na cancer areas or cancer types, no, para sa mga kababaihan na pwedeng malaman or gamitan itong PET CT scan?
Yeah, we do a lot of breast cases, no? Breast cancer, yun ang number one sa women. And then we do also pet a lot on gynecology cases, no? Yung mga cervical cancer, uterine cancer or endometrial cancer, ovarian cancer, yan. Yun yung tatlo. We do a lot of PET scans on these cases.
Yun po pala yun, Doc Munich, no? Breast cancer, endometrial cancer, at ovarian cancer.
And cervical cancer.
Cancer. Yun po pala yun, Doc Munich, no? Doc Munich, napakaganda ng ating usapan at kwentuhan ngayong araw, no? Pero bago po tayo magtapos, marami pong mga health checkers ang nagtatanong, saan po ba kayo papakonsultahan, no? Kung kami po ay na-require ng ating mga doktor na mag-PET CT scan, saan po ang inyong mga centers na pwede naming bisitahin?
Yeah. I'm at the Nuclear Medicine and PET CT Center of Healthway Cancer Care Hospital. Nasa Arca South po yan sa Taguig. And also at the Dr. Conlu PET CT Center. It's a standalone PET CT Center along Shaw sa Mandaluyong.
Ayan po. So, Doc Munich, para po isara ang ating pagkakwentuhan, ano po ang inyong mensahe sa kasalukuyang selebrasyon ng ating National Women's Month?
Okay. But PET CT is more than just a diagnostic tool. To me, it's a beacon of hope, guiding physicians and patients to the best clinical decision that they can make. So, again, we use PET CT for staging, re-staging, assess treatment response, and also for surveillance. So, ito yung mga indications ng PET, and we use these a lot also in when it comes to women's health. We use this for breast cancer, for gynecologic cancers. So yeah, so just I repeat, this is more than a diagnostic tool. So PET CT has a great clinical impact on the management of cancer cases, and the impact is consistent across all cancer types.
Beacon of Hope. Maraming salamat po, Dr. Raymond Augustus o Conlu. Sana po ay bisitahin niyo po muli kami dito sa Health Check Plus, ang programang pinagkakatiwalaan ng mga eksperto. Huwag po kayong bibitaw, magbabalik po ang Health Check Plus kasama ang isang global business leader at founder of Better Days Community. Wellness tips, susunod na.
Usapang kalusugan sa Health Check Plus. Alamin ang mga payong medikal galing sa mga totoong eksperto. Ang kaalaman ay kapangyarihan. Usapang kalusugan sa Health Check Plus.